People are very angry at the situation, and they have a right to be. But mostly, Claudine, they're scared.
Yeah, if you are an Independent Health Medicare Advantage plan member with individual coverage, you may have heard that come January 1st, you will be considered out of network if you have to go to Roswell Park. Good evening, everyone. I'm Scott Levin. Mary Alice is off tonight. It's a story that you saw first on Channel 2, and it's not sitting well at all with patients or the cancer center itself. Channel 2's Claudine Ewing is here tonight with new reaction from Roswell. Claudine?
Scott, this decision affects about 5,500 Roswell Park patients. And today I had a chance to ask the CEO, Dr. Candace Johnson, how did we even get to this point? Roswell Park is not staying silent about the matter. The Comprehensive Cancer Center now running a commercial about their disappointment with Independent Health. How did it get to this point?
It stems from these plans that arose maybe 2 or 3 years ago that lots of insurance companies, these Medicare Advantage plans, they oversold them. They were low cost or sometimes zero premium. And so now, after a few years, the costs of covering those individuals on those plans have been so high that insurance companies just can't afford to keep them.
Independent Health said in a statement that unfortunately, despite extensive negotiations, Roswell Park chose not to participate in their individual Medicare Advantage plan starting January 1st. Independent Health did say after extensive negotiations, was that the case?
There were no extensive negotiations around this point. We were told this is the way it was.
Can negotiations work out with Independent Health?
I would love for us to come back to the, quote, table and talk about how we can do this, because these are patients that we're talking about. These are people's lives, and we'll do anything. I'll sit down today.
There is panic and anger.
They have a right to be, but mostly, Claudine, they're scared. And why wouldn't you be? Because your sort of world has been turned upside down.
Causing more stress for patients, she says. And while there are other options, it can disrupt a patient's care. Is this a sign about insurance companies? It's too expensive. Even hospital care is just too expensive.
We're always trying to find ways to cut costs and be more efficient.
I did ask about Roswell receiving public funds.
We get about $100 million from the state of New York.
Insurance companies get public funding too.
The money that we get from the state really doesn't go for clinical care.
Dr. Johnson says they will not abandon patients. They will find a way to assist them. You can call 800-ROSWELL. They want to make sure that if you are an individual Medicare Advantage member with Independent Health, that you don't have a break in your care. On your side, Claudine Ewing, Channel 2 News.